Good morning, everyone. It's Nigel Giam here, Lead Training Program Director for the St Mary's Scheme, AKT and RCA Trainer for HEE London. I am so happy to have Alvin on this morning to share some of his top tips as to how he smashed the RCA. Alvin, firstly, huge congratulations. Well done. You must be very, very happy.
Yes, very happy. Yeah.
Yeah. So your narrative, I suppose, in a way was quite challenging. You did take the exam before, scored around sort of mid 130s. Your most recent sitting, though, your mark has jumped up by over 50 to 184, which is a huge improvement. What were the main game changers for you? What changed with this sitting?
Yeah. So I passed on my third attempt. So the first two attempts, I felt that I was more kind of formulaic in my approach. So I did all the first two attempts. All my submissions were all telephone.
Right.
What I'd do would be I'd basically write down sort of questions I wanted to ask the patient, and I felt like I had to get through all the questions before I finished the data gathering. So it was almost like a kind of checklist, do you have this?
Yeah.
And I wasn't really reflecting back to the patient or kind of talking to a friend or making it conversational.
Yeah.
I felt that doing it on the phone, for me, is very, very difficult because you don't really have the human aspect of it.
Yeah.
So on my third attempt, I decided I need to change things. So
Okay.
I was trying video and face-to-face.
Right.
Video is definitely better than telephone.
Okay.
And face-to-face for me was definitely the best.
The best. Okay.
Even though you have to take into consideration doing an examination, that's going to take a bit of time.
Yeah.
As long as you do a focus examination and sure it's pretty to the point,
Yeah.
you'll get it within time, I felt.
Yeah. Okay. And so that's a huge strategic change than actually showcasing interpersonal skills, showing that human touch, especially face to face. Some of our trainees out there will be now sort of asking, how did you record if it face to face? Did you have to invest in external recording equipment? How did that work for you? How did you get those recordings?
So first of all, we had a camera in the practice already.
Okay.
So, it was just on a kind of stand, and I put it in the right corner of the room.
Okay.
I'd say you got to think of certain technical aspects. So sometimes you might forget to press the right button at the start.
Yeah. Okay.
So you just got to think of those things. But after a while, you just get into the motion of it.
Okay.
In terms of consent, I used to just I print off a consent form from websites. I would ask them first about what the reason for the recording was, and you just need a signature before you start and then after. I'd consent them before, then make consent them afterwards, and it's pretty straightforward really for that process.
Okay, so those practical aspects people shouldn't be fearful of. They should just crack on, try it out, and obviously they'll start getting used to it. Now, obviously, we talk about marks, and there is objectivity in how we mark. When it came to actually looking at those three kind of domains, obviously your marks would have gone up for every single one of them massively. If I could ask you, I suppose, just closing, in your previous sittings, which was the biggest domain that sort of jumped up the most?
I think it was interpersonal.
Right. Okay. And that's interesting, isn't it? So that kind of goes back to you mentioned that kind of conversation, that kind of communication with your patient, rather than actually talking with. Alvin, last final tip for those who are out there and obviously feeling because I suspect, you would have gone through that feeling of feeling quite despondent having not made it. Obviously now you've absolutely smashed it. What kind of words of encouragement can you give for those who are now facing this autumn RCA?
So obviously it's very disheartening when you fail. But I think once you get the right strategy, you can definitely pass exam. I think in hindsight, it's not that hard to pass, but it's very hard to get a good case.
Okay.
Just work at getting good cases, trying to find cases where there's good ice or good angle.
Yes,
that's really important.
Excellent.
So it shouldn't really be. There should be some sort of story behind it. So it shouldn't be. Kind of, I have abdominal pain. I have no concerns. I have no expectations.
Yeah.
Some sort of angle you can use. So for example, one of my cases, it was a patient who was 40 years old. His brother colorectal cancer, and he had abdominal pain now. So obviously it's about addressing that ice, saying, I'm really concerned here. I'm sure in my shoes, I'll be in a similar position as you. This concern. Let's see what we can do today. And then when you get to the management plan, readdressing that ice again. So for example, I can see you're worried about cancer, what's your brother's history. But to reassure you here, you have no red flags. I think it's something like, let's say, IBS, and then giving a really good explanation of IBS, but then going back to ice again and saying, you're obviously worried about cancer, but we will do further tests, for example, FIT test, which is very sensitive and it's kind of really engaging with the patient and really putting their mind at ease.
Yeah, excellent. That really hits the nail on the head. So specifically, not just challenge, but angle, staying close to the ice, using the ice, readdressing the ice, and thinking about your risk management. Alvin, it's been an absolute pleasure. So happy that you've passed. So happy. Okay. What is the plan post CCT?
So, I mean, I only found out last week, so I haven't really thought about it yet, but I'm thinking maybe doing salary, maybe 3 days a week and doing out of hours after that. So that's kind of my plan.
Excellent. Well, the world is your...
We'll see.
Yeah, absolutely. World is your oyster. World is your oyster. Alvin, please keep in touch. Thank you so much for your time this morning, and take care of yourself.
Thank you very much. Thanks for your help as well.
No problem. No problem.
Thank you very much.
Thank you so much to Alvin for giving him, his top tips, and specifically thinking about what needs to change with a resubmission. He highlighted that actually moving to remote video, moving to face-to-face, really showcasing interpersonal skills, making sure that actually we're just not talking, at patients, but talking with patients. We don't just want formulaic consultants. So think about the power of human touch. Think actually about what you're trying to showcase. And when it comes to thinking about your own case in terms of objectivity, which domains have you fallen down on? Is it being around data gathering? Have you spent too long with that because we haven't kind of used the information from the notes in context? Is it really not giving yourself enough time to get into that second section of clinical management, not committing to risk, not thinking about the most likely differential so that you can base a reactive management plan around that? Or is it around those interpersonal skills which Alvin highlighted? We are moving back to face-to-face in a lot of practices now, so really do think about the practicalities of recording. Start thinking about how you're going to best showcase yourself to smash the RCA. So really glad to have had Alvin on. Really hope to interview a few more ST3s in the lead up to the autumn RCA. If you've not been successful, please don't hesitate to reach out. Lots of resources on the website, mentormededucation.com. Lots of support on the Facebook support group, Mentor MRCGP. I really hope you enjoyed this one, and I really look forward to seeing you guys on the next one. Many thanks. Have a great day.